Why don't pap smears ever get invited to parties?
I don't know.
Why
Why
Dr.
don't
Scott?
they?
I love that enthusiasm. Okay. Because they bring up sensitive topics.
Yep.
That didn't do it. We might have to do another one, but we're gonna let this one flow.
That's a dad joke.
Yeah, we're gonna let this flow. All right.
This is STIRRUPS, Candid Conversations in Women's Health, the podcast where we answer your burning questions and discuss the evolution of women's health through every stage of life. Join Dr. Randolph Scott and duly certified women's health nurse practitioner and certified nurse midwife, Kerry Autry, as they discuss the unique health concerns women face and share expert advice to assist you on your journey to maintaining your health and wellness. If you're looking for informative discussions, tips from qualified professionals, and a community dedicated to women's well-being, then you're in the right place.
Yeah. So we know it's not everyone's favorite errand. No one's ever said, what sounds like an incredibly fun thing to do today? Let's put on a gown and do my annual exam. But hey, at least our gowns here are fabric, not those crinkly paper ones. We hate those. And we promise the visit, it's more important than you think it is. So kind of bringing us into what is an annual exam, Kerry?
Well, the annual exam, everyone always thinks of the pap smear, right? It's like the star of the show or the anti-hero of the show, maybe. But it is a really important exam where we cover a lot of different topics with regard to your health, right? We try really hard at Carolina Elite, and I think this is true of a lot of providers, to be very holistic providers, that we're asking a lot of questions about your overall health.
Definitely. It's a good chance just to check in on everything, mostly your reproductive health, general wellness as well, that holistic wellness that you're talking about. Talk about everything from periods to birth control, breast health, mental health, anything else on your mind. Great little chat session. It's a really good check-in.
Yep. Maybe my mind thinks a little bit differently. I think all those things are good things, but it's kind of like your yearly team huddle, where you check in, game plan, update stats, and make sure that the star player is as healthy as possible, along with their family and the kids and all that good stuff. So it's a good time to catch up on those things. And so overall game plan about your year, your health, and moving forward from there.
Dr. Scott bringing his football coach experience to the GYN
I know.
annual exam
Oh,
podcast.
man, that's-
I love it.
Well,
Wait,
this year,
ladies, I
can't
know.
game
I
plan,
don't know.
the huddle.
I said it, but now I
love
don't
it.
feel all that comfortable about it. Now it sounds a little misogynistic.
No,
hey,
no,
ladies,
no,
don't
no.
come for me.
His head is always in the game.
But hey, I ain't on Facebook, so y'all are good. Okay, on Twitter, none of that stuff. So anyway, I'm sorry.
So when we're talking about annuals, it's important to consider who needs an annual and then when do we need it. So who needs it? Everybody. Anyone from teens, adults, post-menopausal patients, everybody, all female patients, we all need a place in the exam room. And even if you're not sexually active, even if you're not having periods, we all need the annual. Visit's still important.
And so it says annual. Does it need to be every single year?
That's a good question. What do you think?
I like to see my patients every year.
Yeah.
It's just a great point to check in. And we'll talk a little bit more about it. Maybe we're not doing a pap smear every year, but it's still a great point to just see how you're doing, kind of check in and see if there's anything else that's come up. I think a lot of times we're asking questions that people don't anticipate, things that are kind of maybe a little bit more out of the norm, but making sure that your whole health is in a good place.
Yeah. I think that's a great point. I do like to see people every year just for that check-in.
Yeah.
It's nice even if you just get a gold star. We're like, see you next year. Glad you stopped by. Great to see you. And then when we do need a pap smear, getting that done. So I think it's important to talk about for our most younger patients. Do they still need an appointment? What does that look like? Because they're kind of balancing between seeing their pediatrician and then, starting to get periods. Do they need to come to the GYN office? We get asked that a lot. And we were just talking about that. And it's always the mom who comes in and she's like, you know what? Now that I have you in the room, I've got a 14-year-old. She just got her period. Does she need to come in? And what's that going to look like? Because she's quite scared. And I get that because, all of them think they're going to come in. We're going to hand them a gown and be like, okay, let's do pap smear right here, right now. And that's not it. So a lot of times they just come in, we talk about their periods. We say, believe it or not, we shouldn't be missing school because our cramps are so bad.
Right.
It's a huge part of it. It's a big misnomer. Shouldn't be missing school because our cramps are so awful. Sometimes our periods are super irregular. Got to talk about that. Sometimes we want to talk about birth control. That's on the table. It's a good conversation piece to have. So, are you ever too young to see us? No, because there's always things we can talk about.
Absolutely.
And even if it's like, hey, I know my period's coming. What's it going to be like when it comes?
Right.
That's something great to talk about too.
And it's so nice to get young women in the office before they need exams.
Yes.
Because it's a great opportunity to have them in the space, have them meet us, jokingly, but have them meet us with their clothes on.
Yes.
Because it's a much more approachable way. And, especially when we're seeing somebody that young, that should be the expectation that we're really just going to be talking. I mean, maybe we'll listen to your heart and lungs, but it's really going to be a very comfortable, very simple physical exam. But it's a great opportunity to start to ask questions about women's health.
Yeah. And to have a safe space, because I think there's so many times where we're like, that question's too weird. I can't ask my pediatrician. I don't want to ask my mom. Don't want to ask my older sister. So who do I ask?
Right.
We're like, ask us, please. No question is too weird. We've heard it all. At this point, we've heard everything. You can't freak us out. Please ask us.
I don't know, Katie. Sometimes I'm surprised.
I get a little excited when I get surprised,
Yeah,
though. Like,
that's
I feel like you
true.
answer a lot of the same
Yeah.
questions. People, things that people think are crazy, everyone else wants to ask the same question. So at this point, when somebody really shocks me, I'm always like a little excited.
Yeah, it's a little bit different. But I got a great poker face, and so I pretend like I heard it all, and so it's the same deal. But
It's coming
Katie,
back.
no,
I
I'm
feel like
sorry.
I lost it during COVID. We kind of didn't have to have the poker face because we had the masks on all the time, but it's
Right.
back.
Yeah, most
That's true.
definitely.
Bring COVID back.
We had a
it's
built-in
kind of.
poker face.
Yeah. So Katie, when are you going to start the pap smear though?
So that's a good question. So we technically don't need to start until we're 21. And that is regardless of sexual activity. So we get asked that a lot. We'll get asked, hey, I'm not sexually active. Do I technically need a pap smear? And pap smears are really for prevention of cervical cancer. So yeah, we want to start at 21, ideally, if the patient's up for it. And so like we were talking about, we would see you before then, kind of establish, seeing you as a patient, talk about your periods and everything, and then do your first one when you're 21.
And when I get patients in for those younger exams, I will even ask them, we're not going to do a pap smear, but do you want to see a speculum? Do you want to see the brush that we use so that when we get to that first pap smear, it doesn't feel as foreign or as shocking?
Yep. Yeah. I had a 5-year-old patient the other day who thought the pap smear brush was so cool. She had to go home with one
By all
because
means.
she was a magical fairy princess, and that was her wand.
See, that
So,
would have shocked
never
me.
too early.
That would have shocked me. Yeah.
She just
Okay.
picked it right
All
up, and I said, "Yep, okay, that's yours.
That's
now.
yours now.
Great.
Yeah.
Glad you love it.
We
It
give
is
out
pink.
we
It's
give out
cute.
favors. Who knew?
Great. Party favors. Thanks for stopping by. Yeah. So I know we talked about, for younger patients, what that looks like. So we know we get our first pap smear at 21. But what does it look like onward from that? When we get kind of out of our 20s, start getting into our 30s, our 40s, what's that looking like?
I think I think as GYN, OBGYN providers, we kind of lose patients, right? Some we're in the late 20s to late 30s. People had their babies and they're not having babies anymore. And their primary care will do their pap smear. So they feel like there's no reason to come in. But I will tell you, certainly starting in 30s, 40s, and 50s, we're asking very different questions than your primary care provider.
Most definitely.
So when you're here, we always we're still talking about your periods, right? Like we still want to know what that looks like. And periods can become very different in your 30s and 40s and 50s. And sometimes it's a different that's just new and strange. Sometimes it's a different that we really need to be managing in one way or another. So we're asking about thyroid issues. I'm always screening for thyroid concerns because the thyroid touches on so many things. Any symptoms, urinary tract infections or urinary frequency or incontinence, stuff can start to come up in the 30s, 40s, and 50s. So they're just a different type of questions than I think your primary care may be asking you. Of course, they're great at weighing in cardiovascular health and all those things. But when it comes to sexual health, libido, those kinds of things. I think we're a little bit better at asking those questions pretty directly because we're talking about those kinds of things all day long.
Yeah.
When you're in your 30s, 40s, and 50s, your providers should be asking you, how is everything with sexual intercourse? Are you having pain? Are you having as often as you want to have it? All those things. Right, which nobody else is
PCP ever
asking,
asks us,
right?
how's your sex life?
Right.
It just doesn't happen.
In that part of life, we're still talking about birth control. We're still talking about what does that transition from birth control to maybe hormone replacement look like as we get into perimenopause, menopause. And then, of course, like the elephant in the room, we are always asking about perimenopause symptoms and then about menopause. I think I feel like it's getting out there more, but I think not many women are as aware how early perimenopause can really start to show up and how it can really affect so many different symptoms. I know I said this in our menopause and perimenopause talk, but there are so many times when I see a patient and she's seen like 8 other specialists because she has all these varied symptoms, and all these other specialists, from cardiovascular to neuro to everybody has said there's nothing wrong with you.
Right.
And she's like, well, why do I feel this way? And it's time to start asking questions at your annual exam with your gyno.
Yep. She's got hot flashes.
Exactly.
She's got palpitations. She's got anxiety. She's got everything.
Or my what I hear most often is I just don't feel like myself.
Yeah.
Like I can't put my finger on it, but I just don't feel like myself.
Something's not
So
right.
sometimes this is the place where you need to be asking questions. So annual exams continue to be really important through your 30s, 40s, and 50s.
All right. Now that you guys know that the gynecologist has all the answers for you, let's talk about the pap smear. Now, Katie, of course, we start the pap smear now at age 21. Years ago, we were starting pap smears when young women started to become sexually active, and that's no longer the case. So you can certainly be young and sexually active, but not necessarily have the physical pap smear. We still do recommend the examinations and the evaluations overall. And so there's some guidelines that we really go by in terms of pap smears overall and when they should be done. Of course, we're starting at age 21. Years ago, we used to do them every single year. And so that's where the yearly examination comes from, because that was part of what we did. That was part of what we would do for patients and give them that reassurance that, hey, your risk of cervical cancer through the pap smear is relatively low based upon your findings. But now times have changed. We've gotten a lot better in terms of detecting cervical cancer. So the testing itself has gotten a little bit better in terms of adding HPV to the pap smear. So we don't do them as frequently, but that becomes the right person in terms of minimizing the frequency for you. And so if you are a little bit higher risk, meaning that you've had an abnormal pap smear, you don't want to stretch it out to every 3 years because there's a lot that can happen in between that time. And so not every situation is right for the same person. And this is where you get to talk to your provider and say, hey, this is right for you and not necessarily right for somebody else. And so guidelines wise for us, when you're in your 20s, every 2-3 years, certainly I think is reasonable if your situation doesn't change. Now, how often do you think your situation changes when you're in your 20s?
I don't know. 20s are a roller coaster, up and down every day. So who knows? Honestly, you might move across the country.
New boyfriend?
You might get a new boyfriend.
Okay.
Might get a new job.
Okay.
Might
Or
get-
girlfriend, excuse me.
Or girlfriend.
Okay.
Oh, yeah. New partner. New
There we go.
city. New dog.
Okay.
And
there
maybe
you
you
go.
need a pap smear. But yeah, we get many a new 20-year-old patient who's like, I just moved here and I'm establishing. I have no idea when my last pap was. It was somewhere else. And we're like, perfect. Let's establish care.
Yeah.
Let's get that baseline, see what's going on, go from there.
Yeah, and so certain things change a lot. Your life starts to slow down a little bit once you start getting in your 30s, and so pap smear frequency is still.
I don't know.
I don't know.
I'm still waiting,
All
and
right.
I'm not in my 30s. I'm just gonna say.
Okay, maybe if it doesn't, but anyway, the 30s is a time to pause a little bit. Certainly from the frequency standpoint, again, assuming no changes for you. we're talking about every 3 to 5 years, depending on the kind of testing that you actually have done. And so now, does that get you out of the yearly evaluations that you should have? No, is the quick answer to that. But your examination should include a lot more than just the pap smear in itself. And so this is where, mammograms becomes more of a factor. And so I have Kerry touch on mammograms and, the timing of that.
So we start mammograms at 40 for most people, but that can change depending on your personal history and your family history. And family history is a really important part of determining when we start them and how often we do mammograms. Genetic testing has come a long way. I really like genetic testing, but that is also a really important conversation that is probably best had with a gynecologist as opposed to your primary care provider. But really understanding your family history, assessing your personal risk, and determining your timeline for mammograms, depending on that. Because some people really should and do start mammograms as early as 30. And again, that's mostly with people with a pretty strong family history. But typically we start at 40. And the guidelines for mammograms are also confusing. And I feel like this is partly because there's several different organizations that weigh in on who should be screened and how often they should be screened. And then screening recommendations were changed pretty dramatically, sort of across the board during COVID. I think mostly from a practicality standpoint, but those recommendations have not come back to where they were before. So currently, the recommendation for most people is a mammogram every 2 years.
Yeah, and so that's something that's evolving, certainly changing, perhaps, maybe even extended depending on testing and how things are going for patients and all the genetic testing that you were speaking of. Gets better
And I
in terms
know,
of that.
I was going to say, I don't think I'm the only one here, but we change our recommendations based on a personal patient history. For instance, if I have a patient who is on hormone replacement therapy, I want them to have a mammogram every year.
Yeah, absolutely. Absolutely.
So it's the every 2 years starting at age 40 is sort of a starting point, but then that's a conversation that you're having, and the recommendations may continue to evolve throughout your life as we're responding to things that change in your life.
Absolutely. Now, it's important for us to note really that those are screening recommendations. It's difference between a screening and you have a problem. Okay. So
That's a great
if you're not
topic,
having any
Dr. Scott.
problems at all, that may be the recommendation for you. However, if you come in, you feel something that's a little bit abnormal, you have a rash, you have some tenderness, that doesn't necessarily need to wait until you're 40 and be like, girl, I'm 34. I'm going to pause on this. It's not a problem. No, we want to address that immediately for you. And so
Actually, Dr. Scott, I think you bring up a great point that I think is often very confusing to patients. Can we dig into a little bit the difference between screening testing and diagnostic testing? Because that means something really specific to us, but it can be really confusing to patients with regard to pap smears and colposcopies or screening mammograms and diagnostic mammograms.
yeah, and so it's really simplified with respect to screening versus any diagnostic testing. So screening means, all right, I don't have any problems. I don't have any symptoms. Family history, not really of consideration for me. It's just a good thing to do. Okay. It's
Right.
appropriate. Risk assessment at that particular time becomes relatively fruitful in terms of you finding some information. Anytime you dive into something diagnostic, that means there is a problem. Whether it's a problem that you have a symptom personally, again, breast lump, breast tenderness, breast rash, those things become more of a diagnostic situation. And when you do diagnostic testing, you're looking for a particular finding. Okay. And so the screening testing that you have, particularly when we're talking about mammograms, are limited. They're not as exhaustive. The diagnostic testing is more comprehensive. They do more imaging, and they may even recommend some additional testing, some additional imaging to figure out exactly what's going on. So if you're getting a diagnostic, though, I do want to actually point this out too. It does not mean that there's a problem. It just means we're going to be as thorough and exhaustive about the particular issue that you may have. So just because I send you for a diagnostic, everything still is okay until we have proven otherwise for you.
Yeah. I usually tell patients that screening tests are relatively easy to do. They're relatively inexpensive to do. So we do them on loads of people. The problem is they bring back a ton of information, and that information now needs to be sorted through and decide what's really important, what's really concerning, and what's not. And that's when we move on to that diagnostic testing, which is a little bit more invasive, a little bit more expensive to have done, but it's still just sorting through information.
Right.
Yeah.
So I think colposcopy is a great example.
Right, to go from the pap smear, which is a screening test, and really the annual exam itself is really all about screening and understanding, sorting through a lot of information about your health and deciding where we need to dig in a little bit more to have a better understanding. So like the pap smear is the screening part. And if something comes back on the screening part, then we move on to that more diagnostic testing that you were mentioning.
Yep.
Yeah.
Exactly. Dr. Scott, do you want to explain colposcopy?
Colposcopy. We get that all the time. Colonoscopy? Nope.
Not
the colon.
colonoscopy.
Not colon. Nope. And so anytime that you've had an abnormal pap smear, depending on the abnormality itself, it determines whether or not if you need to take a closer look under the microscope. So think of a colposcopy as just a microscopic examination of the cervix. And it helps us to figure out if there's more of a problem or issue or concern for you. Pap smear wise for us, we got some things covered. We also went through mammograms. Katie, what else could be evaluated at the time of your annual exam?
So that's a great question. So other than what we've talked about, we also do STI screening. We offer that to every patient, but specifically if someone's under 25 and they are sexually active female, we do always recommend that we do STI screening. And so that's testing for chlamydia, gonorrhea, trick, and then some of our bloodborne infections. It's just a nice checkoff. You know, when you get your exam, make sure that there's nothing we need to worry about, especially if we're thinking about new partners, multiple partners. We always want to kind of be on the safer side of things. And so it's a nice little check off at our annuals.
Can I add one more screening?
Mhm.
Probably because this is one of my biggest pet peeves in women's health.
Okay, go for it.
The DEXA screening, bone density screening.
Yep.
We
Yeah,
didn't touch on
so
that one. Yes.
Officially, bone density screening begins at 65.
Mm-hmm.
Unless you have really specific risk factors, then we recommend it earlier. For my patients, I am usually having a conversation. I will say something like, we recommend beginning screening at 65 years old, but the trouble with that is one of our best defenses against bone loss is hormone replacement therapy, and I can't start people on hormone replacement therapy at 65. So if I've waited that long, so that's a conversation that I'm having at the appointments, you know, especially if they're risk factors, late 40s and certainly throughout the 50s. So I might be sending people for DEXA screening at that point. But it's an imaging. It's done at imaging centers, usually very similar to your mammogram. But I think it's really important screening that needs to get done.
Yeah. And I think PCP tends to usually start thinking about it around 65.
Because those are the guidelines, to be
Right.
fair.
Exactly.
Yeah.
But because we are always thinking about our hormones, I think that's definitely a great point to bring that up early. Because preventative is always be on that side of things.
All right. You got a pet peeve there, Kerry? I have one too.
I have so many.
Well, yes. As it relates to the screening, there is one out there that I think our audience should be aware of. When should you stop that pap smear?
Oh,
Yeah.
yes.
Yep.
This is a good question.
When do you stop them? So guidelines and recommendations are at age 65, the pap smear is no longer as a useful tool. Can they still be done? Absolutely. But after age 65, if you have not developed cervical cancer by the age of 65, the likelihood that something else in your life is going to be more problematic exists for you. I mean, heart problems, diabetes, things like that.
Bone health.
Yes, that trumps the pap smear in itself. And so usually after 65, most providers will stop the pap smear itself. Okay. I know it's hard to stop it, but
Get in the routine of
Yeah,
things, and you
absolutely.
just feel like you should get that
Absolutely.
tune up. And
It's reassuring, right? I get it. Like patients feel that you can't see your cervix, you can't see your uterus, and you get that reassuring, check the block, everything is good. But I agree with Dr. Scott. We need to stop at 65 unless you have a personal history of abnormal pap smears in the recent past.
In the recent. Yeah.
I know. Sometimes people are like, I had an abnormal one more than 20 years ago. And I'm like, we're good.
I think we're okay.
We're good. Yep.
Thank you for filling in.
However, you've also had like 18 normal ones since then, which is good. Good.
All right. And so some of these now, in terms of, topics moving forward for us, I think we can kind of get down to some myths and misconceptions. Some of them we covered a little bit, and so I'll kind of let Katie start off in terms of some of the myth busting that takes place.
Yeah, so I think, we covered it a little, but there is that myth that you don't technically need a GYN exam every year, and that theoretically, if you only needed a PAP every 3 years or 5 years, that you don't need to come see us. That is a busted myth because you still need your annual check-ins. We do breast exams, we check on hormones, we have conversations, want to make sure period is not a concern, and we've got to talk about our preventative care because if we're not seeing you, things aren't on the table to talk about. You know what I mean?
And sometimes we're prescribing medications. So we need to have that check-in to make sure that the medications that we're prescribing are still appropriate for you because sometimes things change. And even your basic birth control pill, sometimes things happen in your life that's no longer an appropriate medication for you to have. So we need to be seeing you every year to make sure that nothing has changed in your health history and that the things that we have kind of on autopilot in the background are still appropriate for you.
Yep, exactly.
And sometimes I feel like, we're your biggest cheerleaders as well.
Sure.
I mean, for things you have going on in your life, from a health standpoint, but outside of that too, it's just like the birthday. We're celebrating your health overall on a yearly basis. So I think it's good for you to come in on a yearly basis.
That we really
Yeah.
love pictures.
Yeah.
Like if you got married,
Right.
I want you to bring pictures.
Yeah, or if we're taking out your IUD, exactly. Maybe
Exactly.
start trying.
Yeah.
I want to know that. I want to be a part of it. I want to talk about it before it happens. It's exciting.
Let me tell you, I don't think patients really understand how much it warms our heart when you help somebody have a baby and you see the updates that's coming along
You get
the
to
way.
see the
and-
pictures when they come in. I
oh
know.
my goodness, it's so inspiring to see when you're
Two-year-old
that
comes walking
yeah,
in
that
and you're like, oh
two-year-old
my goodness,
little
I saw
bow-legged
you in
legs
that
running-
belly.
Yes.
Yep.
I mean, do I feel really old now? But yes.
Yeah, right. You're like, oh, you're 5 now.
Yeah.
Oh, okay.
I remember you as
Yeah.
a 7-week fetus.
Yes.
Yeah, I know.
And you were still as cute then.
I had a patient earlier today, and she said, Dr. Scott, you got a distinguished look. I said, oh my goodness. She just called me
boy.
old. She called me old.
She said
she called me old.
Use the polite word.
Okay, she saw my gray hair. I'm
She called
getting
you
a haircut.
wise.
I'm getting a haircut. I'm sorry. All right. And so with that in mind, we'll let Kerry follow up and bring this a little bit to a close for us.
So I think one of the other myths, which we already talked about as well, that you only need to come see us if you're sexually active.
Right.
Our patients, you continue to have a uterus, you continue to have all these hormones, you still need to come see us so that we can make sure everything's going the way it should be.
Exactly. Yep. No one loves the STIRRUPS, but we love helping you feel like you're in control of your health.
Yeah. And lastly, if you don't follow that annual exam, that's okay. We accept you back with open arms.
Oh, for
So-
sure.
Yep.
Yeah.
With pictures.
With pictures, yes.
You got to have pictures.
We
Right?
want to hear everything that happened in the last few years.
Thank you for joining us on this episode of STIRRUPS. Be sure to send us your women's health questions and topics you'd like to cover by visiting our website, carolinaelitewomen.com. If you enjoyed today's episode, please subscribe to the podcast and spread the word by sharing it. To find out more information about Carolina Elite Women's Care, visit carolinaelitewomen.com. This podcast is edited and produced by Earfluence. Stay healthy and stay empowered. We'll talk to you soon on STIRRUPS.